Well, Dr. Sonia, let's dive into the topic of skincare. Since you co-edited the leading textbook on ethnic skin for dermatologists around the world, what are your top recommendations for women with darker skin?
So we know that by the year 2050, over 50% of the population will be skin of color. And actually, it's probably even faster. So there's going to be a whole demographic change that's happening. It's already happening. And we know that skin of color has definitely some unique challenges. I will see a higher percentage of them having things like uneven skin tone, hyperpigmentation issues, melasma, which is that mask of pregnancy, that blotchy symmetrical pigmentation, which is very, very difficult to treat. Keloids and scarring. All of these are huge challenges for skin of color. And the danger really becomes when you're not using the right products and you're not doing the right treatments, or you're seeing a place that doesn't know skin of color and they're not experienced in our skin. That's when the real danger comes. And I have definitely seen issues with, scars, permanent damage. We're a referral site center for skin of color and complications, and it's very difficult to treat once the damage has been done. So it could be something like a strong chemical peel, seeing an esthetician and not understanding skin of color. It could be going to another office, getting the wrong laser done. It could be using an over-the-counter product that you thought was safe, but in fact, it could cause pigmentation to get worse and lead to more permanent damage and permanent scarring. So these are all real concerns for skin of color. And a lot of providers and professionals and patients out there are just not aware. So my go-to always is to start again with the basics, medical grade skincare under supervision. I think that's really important because skincare is confusing. It is definitely confusing to know what to use for your skin type. And one of the big things that we do is that we will walk through every step with you. So when you get an Elite MD product, you're going to get started with prepping your skin. We talked about the 3 Ps of pretty skin. We're going to make sure you don't have reactions, you don't have complications, you don't have adverse events. Medical grade skincare will be higher in terms of the good stuff, higher concentrations of quality ingredients. Again, science backed. We know that they work. We know that they are safe when used properly and under supervision. So I'll put our patients on some brightening steps, a brightening product or a brightening kit. But the most important thing is, again, they're 30%. They've got to wear their sunblock. They've got to avoid the sun. They've got to make sure they're really consistent, because consistency is king. Once they're doing the basics, now I go into all of the layers of the skin. I'm going to get a better result. And I know which products and which treatments are going to be safe. Melanin is highly reactive. So when we're not sure about which treatment is right, that melanin is going to be very sensitive. It's going to get irritated, and it reacts by causing post-inflammatory hyperpigmentation, which is very devastating to a skin of color patient who has to go through that process, because it can take weeks and months to a year for it to actually fade with time. So as I always say, consistency is most important. We're helping to treat the challenging issue, but we're also helping to prevent future issues when done under supervision. So a skincare that is, given by Elite MD is always comes with a complimentary skincare concierge. So that way there's no questions. There's no, am I doing this right? We've got your back. It's literally like having a little Dr. Sonia in your pocket at home. So we're going to be following up with you, which over the counter, they're never going to do for you. We're going to make sure that we titrate your skin up slowly. We're going to make sure that you have consistency of results, and we're going to make sure that you're safe through it.